Hi, everyone. Just give me 1 second. I'm putting the live on Instagram. So this is Dr. Amigues, your friendly rheumatologist. As always, it's such a pleasure to see you. I hope you had a wonderful Thanksgiving. Today is going to be a very quick rheumatology 101 because I'm actually a little sick. I have a stuffy nose and a headache. And honestly, it's not as fun as usual. I really do love being here and sharing stories with you. And so this is what I thought. I was like, I'm not going to go into a very intellectual topic today. I'm just going to share with you some stories that I've had recently that have made me just more and more excited to be a rheumatologist, to have this practice. So you can. I'm hoping that you're going to enjoy them, and then I'm hoping they're going to give you hope, because that's really the whole goal of the it's the whole goal of my life in terms of work life. I want to give hope to patients because I think that sometimes it's really hard when you don't know where you're going to be, when you don't know that the treatments are working, when you do not know about treatments, when you feel like your body is different than it used to be. And my purpose in my practice in rheumatology is to make sure that you're always hopeful, to make sure that you realize that there are ways to get you to full remission. And so with this, and my cat is outside, I don't know if you hear it, but um, I apologize for this. So with that said, right, like I wanted to share this recent story that happened to me. So I've seen a patient that has had rheumatoid arthritis for over 2 years, and I started taking care of her. I want to say 6 months ago. Yeah, it's been 6 months. And she came in and she had a pretty bad rheumatoid arthritis, actually. And despite having seen another rheumatologist, and and she's in the healthcare industry, so she's very well researched. She understands what we need to do. She understands all of this, and um, she. I'm so sorry. My cat is out there. I need to let him in, otherwise it's going to be really difficult. Here. This cat is very needy. So where was I? So do you want to say hi? We are live. Here is the cat that brings mice instead of getting rid of them. And very needy. So this patient had rheumatoid arthritis that was pretty severe, despite being over medication. And what I told her is that I like I share with absolutely every single of my patient is that I share the data, which is that right now our goal are to get our patients to full remission. And the full remission means no joint pain, no swelling, no morning stiffness. And what's really interesting is that I changed her treatment, and she started doing better. But really, it's only at her, I think, maybe third or fourth appointment when she had gone more than 3 months of treatment. Um, that is when she actually told me, I'm realizing that it's not okay to be just okay. And I actually did a little Instagram on this where I said, I never realized, for me, when I share that we need to reach remission, I really mean it. We need to reach remission. It's not cured. Cured would be without medication. Remission is full remission, no evidence of symptoms, but you may have treatment. But what was fascinating to me is that when she said it's not okay to just be okay, and I didn't know that. When we discussed this, she basically told me, I didn't realize that remission, as you mentioned, it was possible. I didn't realize that I could have no pain at all. And I felt already so good being at 75%. I did not realize that I could go to 98 or 100%. And it's really funny because the second story I want to share with you, and hi Rayat and hi Rogdoc, Royat Medal, sorry. Royat, we will maybe discuss negative ankavasculitis in another one. Today I'm just sharing story. I have my cat next to me. Today is a very, very laid back rheumatology 101 because I am dealing with a little cold. And so I'm just sharing stories today. And so the second story is of another patient of mine that I recently saw who is not at 100%. And I really, really mean it when I say we can go to 100%. And what's happening with her is that I was telling her, well, you're not at 100%, so I'm not happy. So we are going to tweak a little bit things. And then she says, Dr. Amy, I know you're not super happy right now with where I am. I know that you want better for me. And I appreciate that. And I'm really grateful for this. That said, I want to share something that my husband recently told me. And so she goes on, she says, my husband basically was seeing me play on the floor with my toddler and said, I didn't know that I could ever see you do something like this. And seeing you on the floor playing with our daughter is just so good to realize that it is a possibility, like to see you do this. And it's giving me hope for the future, for you and for us, right? And that is really the reason I'm a rheumatologist. It's because we can get our patients to full remission. We can get our patients to be perfect. And yes, I'm not perfectly happy with her outcome in the sense of I think she can get to 100%. And I think she's doing so good already by being able to play on the floor. That was one of her goals, right? That was one of her goals. So that's one of the most recent stories, and it is funny, right? Because it's almost I could share with her, look, being okay is not okay. That's not enough. Like we can do better. And at the same time, we also can be super grateful for where you are already. So yeah, those are some of the stories. I also want to share another story, that we are on the story section, of a patient that came with really loss of hope. And I see a lot of patients who are here and that basically they kind of come to my practice thinking, well, maybe this is a different type of practice. And it is a different type of practice. And it's kind of like their last hope. So sometimes what's happening is that I can feel that they don't really trust. They are not, like, their trust is not a given right away. And I had a patient who came who didn't know what she had, and she had been gaslit by a lot of her doctors, and she's a young lady. And what's really, really interesting is that we took the time of reviewing her symptoms. So she told me that she had joint pain, and almost immediately I was like, well, you are in the right place because your joint pain is definitely inflammatory. When some of her doctors that she had seen had told her, you're young, you're working out a lot, so that's why. But it was definitely inflammatory. And as as I'm asking her questions, at one point, one of the questions I ask absolutely everyone is, do you have any rashes? And she is like, oh, actually, now to think about it, there was this rash that I actually showed to my, I came to my urgent care or whatnot. And she said, and this said, yeah, this is nothing. I look at the rash and it's psoriasis. And there is a condition that associates psoriasis and inflammatory arthritis, and it's psoriatic arthritis. And here it is, in our first visit, we make a diagnosis of psoriatic arthritis, put her on treatment. She's now in remission. I think within a month, she was in remission. And I think the really cool thing in this story is that by looking at everyone as a full person, right? That's where the UnabridgedMD word came, unabridged, non-edited MD physician, right? by looking at the person as if she had never seen any other people, right? Like as if she had never seen any other dogs, as if there was no editor in there, right? That allowed me, or it would have allowed any sort of rheumatologist, to be honest, right, to just look at it from a very objective standpoint and make a diagnosis. She had it was typical inflammatory arthritis, but the rash was very limited, right? Like, and she had taken pictures, and because I asked her, she showed me those pictures, and it was pretty obvious that it was psoriasis. But the best of this story, the best point of this story is that she regained hope in the whole medical body. And that is, to me, super important, because I do think that the medical body is there for a reason. We're here to help you, right? We are doing this to help. And so always have hope. And if you don't have answers from one doc or advanced practitioner, as we have here, just know that you can have answers from another dog. It might not be the zone of genius of that dog. Maybe you need to see another dog to look at their other zone of genius. All right. Well, that was like free story, or I think it was free stories. I hope you enjoyed them. I'm going to just say hi to Heather. Hi, it's always a pleasure to see you. Thank you for supporting me. Hi to Royette Medal. Thank you. Yes, I will do always when you have questions about different topic, I'm happy to dive into them. I will do that. And maybe next time could be one ANCA-negative vasculitis. And hi, Rock Doc, as always. And then hi, Nicole, and hi, the Cove TM. Oh, hi, Dr. Block. And he was on our UnabridgedMD podcast. And so come and listen to it when you're go and watch UnabridgedMD podcast and listen, because it's always so wonderful to have all the guests that we have. Without further ado, thank you for being here. Thank you for listening to the stories. Sorry that I didn't go through a full topic. Next time. Have a wonderful day, and I hope you all had a wonderful week during Thanksgiving. Take care, everyone. Bye-bye.